When it comes to facial rejuvenation, we really pride ourselves on teaching and educating patients about the whole spectrum, from skin care to fillers or injectables, Botox to surgery. Not every patient that comes in seeking a facelift is a candidate for a facelift just yet, and we have a lot of options available now that are minimally invasive, yet will certainly help the patient achieve their goals. So we try to use a team approach to educate patients as to what is available. If a patient comes in and says they look just tired, that doesn't necessarily mean you need a facelift. It may mean you just need an eyelid tuck and some Botox to rejuvenate your face. In my mind, facial surgery is particularly challenging in that it is somebody's face after all, and not something that's hidden under clothes. It's an artistic challenge, and everybody's face is different. There's no cookie cutter approach to doing a facelift. Different people have different areas on the face that need to be addressed in different ways, and we have a full armamentarium in our office, again, from minimally invasive techniques to full facelifts and brow lifts to help these patients achieve their goals. We offer a wide array of facial procedures, everything from skincare products to chemical peels to injectables, Botox, and minimally invasive facial techniques. The whole spectrum, including facelifts and brow lifts and blepharoplasty or eyelid tucks, fat grafting to the face. In my mind, I like to tell patients to picture a grape, and as that grape gets older, it becomes a raisin. Traditional facelift techniques have concentrated mostly on pulling that skin tighter and turning that raisin into a pea. I like my patients to understand the analogy. I'm not trying to make you look like a pea. I want to help restore volume as well as take away excess skin and make you look like a grape again. So I always tell even facelift patients it's not a one silver bullet technique. You'll probably need a lot of adjunctive procedures such as Botox or fillers to try to get areas on the face that a facelift just doesn't address. That being said, the facelift will give the most dramatic and probably most long-lasting result. Truthfully, I have a lot of patients who come to see me before they're ready for a facelift, but they feel, again, while they look in the mirror, that they look older than they feel on the inside, or they don't look as good on the outside as they feel on the inside. And those patients really do well with minimally invasive techniques, such as maybe just an eyelid lift or some Botox around the eyes. When we see patients who come in for a facelift consult, we start from top to bottom, and some of these patients come in just feeling like they're looking old and they think they need a facelift, yet they're not ready, and by my eye, to go to have something so extreme. So we'll start with minimally invasive techniques such as Botox or fillers, or maybe go as far as an eyelid tuck, and they'll come back feeling much younger and rejuvenated, but Whenever I can, I try to use minimally invasive surgical techniques. Sometimes somebody needs more of an extended surgery, and I'll be very honest, and they'll need something a little more invasive because in order to fully correct their issue, I have to do a full facelift and sometimes a full brow lift. Other people just need a little nip or tuck here, and it takes care of it for another 5 or 10 years.